Hello, 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 and welcome to our Wednesday live. I just noticed my cat jumping up on the printer. He's got this thing about the printer. He just likes to hang out there. And this, of course, is my new office in my new home, which is still under construction, but he's managed to find that printer. So tonight, let's talk about neuropathy. Neuropathy is a super common symptom in people with MS, and I would say it's one that dramatically reduces the quality of life overall. So I think it's a good one for us to address and talk about how we can change that naturally. Generally, we see neuropathy, but it's not limited to the feet and the lower legs. And some of the words that come to mind when I think of how it's been described to me in the past is shooting, sharp, burning, squeezing, wooden, fractured, sore, swollen, tingling, and numbness. So those are some of the different qualities that neuropathy can take, and everybody has their own experience of it. So if you have a different experience of than any of those adjectives, why don't you pop them into the chat, and we can continue to learn from one another. Neuropathy can happen early in a diagnosis, or it can happen later on. So it's not something that has to evolve over time. It can be one of those things that shows up early. And it's different from the normal pain response. So generally speaking, a normal pain response is kind of a message from the body to stop doing whatever it's doing. So there's a stimulus that says to the body, hey, this is going to hurt if you if you continue to do this. So here's a little warning sign, and it generally makes you stop doing what you were doing, and the pain goes away. But neuropathy tends to be a more chronic pain, which means that it doesn't have that stimulus response reaction to it. It's generally speaking from a lesion in that's associated with a disease. And I think if you ask the general public, the most common neuropathy, of course, is diabetic neuropathy, where there's damage to the nerves from uncontrolled blood sugar over time. But MS, neuropathic pain, is a symptom of inflammation or lesions, obviously, in the central nervous system and peripheral nervous system. It can be acute, which means it can be short term, but more often than that, it's chronic, and it's just always there. It's aggravated by the things that aggravate symptoms in people with MS. And the top of that stack is stress. So stress and MS are very deleterious bed partners for sure. Also anything that causes inflammation, and that could include diet and nutrition, that could include lifestyle. What's interesting is neuropathy itself can become a chronic stressor to the body, which by nature of that increases inflammation. So we've got this chronic musculoskeletal wear and tear on that nervous system that causes its own inflammation. So I want you to remember that MS model that I talk about all the time, with the immune activation causing the inflammation, that plays itself out in the brain. So that inflammation activates, oxidative damage, or starts oxidative damage that causes the degeneration in the brain. So anytime we can stop inflammation in MS, that's a good thing. We do have some current medical treatments for it, and they tend to be antidepressants, anticonvulsants, and some cannabinoid drugs. And they work differently for different people. I find I don't find mostly anything. I find that people either respond to them or they don't. And I'm a big fan of not being a hero with pain. So, if you're just not taking anything for pain and really suffering through it, you're just setting yourself up for that chronic stressor, which becomes inflammation in the body. So my rule of thumb, and it's my personal rule of thumb too, is don't be a hero with pain. I went through a bout of a deep nerve pain, which no idea where it came from. It was incredibly phenomenal. And that's different than neuropathy, but I actually took some gabapentin at that point in my life because it was just unmanageable, and it it wreaks havoc on the system. So what I'm going to talk about now is what you can do about naturopathy, but I just see I just want to say hello to people who are commenting here. Sarah, love this topic. Great. So let me know if you have any questions, Sarah, that I'm not hitting on. Hi, Erin from Ontario. Emily Flores, how are you doing, my dear? Yours is in the feet, heat and stress driven, hot feet or tired feet plus stress. That is a great synopsis there. And we're going to talk about some stuff that's going to help you out there, Emily. And my feet are cold to the point of being painful. Is that neuropathy? Oh. Sorry, my mind is doing that crazy rapid fire thought pattern that I described to you before. So it's sure, pain in the feet is neuropathy, and that cold is a little bit different though, Erin. It's driven by the autonomic nervous system. So that imbalance of heat and cold tolerance. So I've got some solutions for you too, though. So let's dive into those. Okay. So generally, what have we talked about? We've talked about this being an inflammatory condition that activates, what's going on in the brain. So of course, top shelf approach is going to be anti-inflammatory, bringing down that inflammatory. And I'm not just going to talk to you about supplements, because what is my standard answer on that about that? Transforming MS naturally is not just about supplements. It's about lifestyle. It's about the things that you can do to help your body to access your innate healing capacity. So the first thing I'm going to talk about, what do you think it is that's anti-inflammatory? Dietary diligence. So what we want to do is take down the foods that are causing inflammation, like the processed foods, specific. So first, right out of the gate, wheat, dairy, and sugar, and then any of the refined processed foods that are going to trigger an inflammatory response. And then bring up all of those colorful vegetables. Think about all those different colors, the greens, the blues, the purples, the oranges, the yellows. Each one of those brings a different set of phytonutrients or plant nutrients to the game. And they are antioxidants, they are anti-inflammatory, they are nourishing and nurturing. So there's your your anti-inflammatory flip on the food. Your self-care is super important as well. And you know my passion about castor oil packs. So that castor oil pack to the abdomen becomes a big deal because remember, I talk about the gut as being that gateway to inflammation, right? That leaky gut that promotes inflammation in the body and then, of course, in the brain. So understanding that castor oil pack to the abdomen really takes the inflammation down. It's also, if you've been working with your diet and doing little things to improve your GI function, you've still got issues there. Maybe you've still got constipation or diarrhea or burping and passing gas and just discomfort after you're eating, then maybe it's time to see somebody that can help you with that, because I can't emphasize enough how important that gate portal is for MS. So your castor oil pack. Sorry, I scribbled some notes today so that I didn't forget what I wanted to tell you. Your daily basics. Remember, we talked about those super basic supplements that are going to have anti-inflammatory and other functions in all kinds of different systems. And those are fish oil, of course, and fish oil can be wickedly anti-inflammatory. So if you find you're having an episode, maybe a teaspoon isn't enough for you. Maybe you should be taking a tablespoon, which is actually 3 teaspoons of fish oil. Your probiotic, which once again is working wonders in the microbiome. Your vitamin D. Of course, vitamin D is an incredibly anti-inflammatory vitamin in MS. And of course, we talked last week about B12 and its positive impact on the nerves. So make sure that you've got those basics in place if you don't do anything else. There are a lot of anti-inflammatory herbs out there that I want to bring to your attention. And I'm not saying go out and buy them in capsule form. I'm saying incorporate them into your diet. Turmeric is a big one for me. And turmeric is so great in so many systems. And we know that it actually enhances brain-derived neurotrophic factor in the brain. So not only is it generally anti-inflammatory, but it's also got a direct and super positive impact on the brain. So find yourself a good organic, because it's always about quality, especially with spices, turmeric powder, and use it liberally. It's good on anything. You can sprinkle it on your rice. You can add it to your stir fries. You can even throw a teaspoon in your smoothie, and you won't even really notice that it's there. Ginger is another herb that's admired for its hugely anti-inflammatory properties. You can do the same. You can put that in your stir fries. You can put that in any kind of foods. You can also add that to your smoothie. Garlic is another great anti-inflammatory. These, my mind is thinking that, hey, these are also great antimicrobial herbs. So remember, you don't just have one action when you're doing things naturally. So you've also got the benefit of the antimicrobial aspects of these herbs. Rosemary is another great one. Brilliant antioxidant. In fact, it's been an ingredient in some of the trendy supplements for MS over the years. I always see the rosemary in there, so that's a wonderful thing. And green tea. Green tea is incredibly anti-inflammatory. So if you're like me, I drink at least 4 cups of green tea a day. And I remember when I was working in the cancer area, 10 cups of green tea a day is actually a therapeutic dose. So that's pretty impressive on its own. So those are some herbs and spices that you can add to your diet as well. I do want to mention a specific supplement, and that is our alpha lipoic acid. Alpha lipoic acid is brilliant in neuropathy. There are thousands and thousands of articles written on our alpha lipoic acid, not just alpha lipoic acid. It's got to be our alpha lipoic acid. And it's been used in diabetic neuropathy literally for decades. So there's lots of scientific data to back that up. I would say it has similar impact on neuropathy and MS. At the same time, alpha lipoic acid, I don't think there's an aspect of MS that it doesn't help. And earlier today, when I was just looking at some of the studies that have been done, it's actually considered a supplement that can reverse MS. So that's pretty keen. It's something that I have in my brain reform supplement that I have created for my patients. It's always been in there, and it's a super important one for people with MS. It protects neurons, it's anti-inflammatory, it's an antioxidant, and it actually reduces that inappropriate immune response at the level of the brain. I want to talk about CBD because it's very popular and it's highly, highly effective. The thing is, it's legal here in Canada now. I'm not sure if it's legal where you are. But because it's newly legal, it's kind of like the Wild West. So you really want to make sure that you find a provider who has got some experience, who produces a good product and a consistent product, because CBD can be so helpful for neuropathic pain or neuropathy. The interesting thing about CBD and cannabinoids in general is that every tissue in our body has receptors for cannabinoids. So it is incredibly important in MS, and there's lots of evidence to support that, and it's incredibly anti-inflammatory. So I know lots of people that use that as a staple. It is officially out of my scope. Go figure, a herb that is out of the scope of a naturopathic doctor. That's what you get when you mix politics into things. So that's all I can say about that. But I would suggest you talk to somebody who is in the know about it, and find a good product and then experiment. I find that it doesn't not help anybody. What's important is getting the dose right, and the dose is different for everybody. And it might be different from time to time with you. You might be having a particularly large flare, and you might need a bigger dose. So people sometimes give up on CBD because they say, oh, that doesn't work for me. I don't believe that. I believe that it's simply not getting the right dose. So that's all I'm going to say. I've said a lot about something that's out of my scope. So I'm just going to jump in here and see what people are saying. Emily's saying Crocs and no socks were my friend for a long time until I could get it better under control. I also agree that I've been a pain. Oh, I'm sorry, Mike. You want me to click on this, right? That way everybody can see it. I also agree that I've been a pain hero. And yes, I do have anxiety about foot pain, and especially when I have to work. You said it, Emily. Don't be a pain hero. There's Lorraine. Lindsay, how do you determine if it's neuropathy? I have constant electric shocks in the legs. And electric shocks can be neuropathy for sure, because what does nerve firing do? It's basically an electrical stimulus, and when it's out of control, it can feel uncomfortable. Lorraine, drop into the chat about where that is. Is it just in your feet and lower legs? In which case I would say absolutely it's a neuropathy. Or is it up in the groin or down the sciatica? Painful. Oops, sorry. I didn't put Lorraine's question. Sorry, Mike, I am learning. Here's someone that just shows up as Facebook user for me talking about pain, stiffness, and balance. For sure. If your feet are achy, right? Or worse, sharp, sore, whatever, that's definitely going to affect your balance. And if your balance is already slightly off, that can just be a disaster, can't it?
Kathleen.
That's Kathleen?
Stafford, yeah.
Oh, Kathleen Stafford. Nice. Hi, Kathleen. Here's Dina. Oh, here. There we go. Acupuncture. Yes. I was going to mention acupuncture later, Dina, but thanks for mentioning it. Acupuncture helps you tremendously. Gluten-free, dairy-free, sugar-free, lemon water, celery juice. Absolutely. Sounds great. So acupuncture, I love acupuncture. I used to do it all the time in my clinic. I have it as often as I can. And I highly recommend it. And constitutional acupuncture that looks at the whole body as well as the symptom presenting. Emily is telling us that we actually just approved medical marijuana in Mississippi. Woohoo! I haven't looked into it though. I would only want to use an oil from yeah, you don't want to smoke it. So let's talk about feeling altered. Because with CBD, Emily, there are no hallucinogens. So you don't have any altered, cognitive capacity. That's the magic of CBD. So definitely look into CBD alone. They often try, especially with medical marijuana, they always say, they always want this percentage of THC and this percentage of CBD. You don't need THC. Even for sleep and things, I find people have miraculous results with sleeping on the CBD alone. Rachel is saying CBD is awesome. I agree. Rachel, is Canaway a brand or a supplier? Lorraine's saying upper legs. Okay. So I'm not sure if I would call that exactly a neuropathy, but in a way it is. All of this will help that too. Hi, Bonnie 20 McDonald. I use oxygen for nerve pain. Works every time for my crazy feet. You know what? I didn't think about that. So I'm a big fan of supplemental oxygen therapy. In fact, maybe we should have a talk on that. But there are a couple of types of oxygen therapy. There's hyperbaric oxygen, which has been used forever in MS. In fact, the last time I read about it, there were 69 free hyperbaric oxygen clinics in England for people with MS to access, which is amazing because it costs about $140 a session here. And then there's normal baric, so just supplemental oxygen. I love that. Acupuncture is great. What method do I use? Well, let's talk a little bit more. So we've talked about, there you go. So Rachel's giving us some advice here on medical marijuana. THC helps with the pain, and depending on the strain, indica, sleep, relaxation, or sativa, to be active, workout, yard work, etc. And once again, I don't find you need to add the THC. And the one thing that, as a naturopath, concerns me is that THC is cleared through the liver. So it becomes a burden on the liver to clear, especially if you're using it a lot. So check out the CBD. That's an awesome one. Canaway is a brand you can sign up for. They only sell CBD. Perfect. Awesome. See? Lots of information here. Sharing. I love it. I love it. So now I'm going to share a few more of the things that I do and that I encourage you to do. And these are more physical things. So starting off with foot massage. And it doesn't have to be fancy. You can just pull that foot up, cross it over your knee, or have somebody else do it even better. Put some castor oil in the palm of your hand, put some CBD in with that castor oil, put maybe a few drops of lavender. Remember lavender oil. It might smell like your granny, but it is a perfect nerve essential oil. So you can mix those all up and then massage your feet. If you really want to be a keener, you can jump on the internet and look at reflexology points on the base of your feet. And there's one right where the pad of your big toe meets, the pads of the other toes. Right in there it's a resuscitation point, and it's an amazing point. So just to massage those feet and up the legs, to get those oils in there to help calm those nerves and have an anti-inflammatory effect as well. You can actually do something called castor oil socks, and this is highly, highly effective, especially if it's really problematic and you really want to get some relief. And in that, you would just use, a little sports sock or an ankle sock, put it on your feet, and then drizzle the castor oil right on that sock. Cover it with a plastic bag because, of course, castor oil is a thick, sticky oil that stains, and you don't want to be tromping it all over your house. And then put another dry sock over top of that just to keep the bag in place so you don't wipe out because you're walking on a plastic bag. And you can sleep with those on through the night. You can wear them around all day, but castor oil socks to the feet are an amazing therapeutic intervention, if you will, for neuropathy. While I'm talking about the feet and socks, warming socks, and I'm going to post, I'll repost my post on warming socks, because warming socks are pretty awesome in general. They do a really great job of mobilizing the lymphatic system, which means they're regulating the immune response. So clearing up those lymphatics means there's less junk being presented to that inappropriate immune response that happens in MS. And they help people sleep better. I get a lot of really good results with warming socks, and I do them myself. How do you do them? You need 2 pairs of socks. You need one thin cotton pair of socks, and you need one thick woolly pair of socks. What you're going to do is run the thin pair under cold water, and then wring them out as tightly as you can. So they're wet, but they're not drippy. You're going to put those over warm feet. So if you've got cold feet, you want to warm them up, run them under the bath, the water in the bathtub until they're warm. Then you can put the cold socks over top, and then the dry, warm woolen socks over top of that. And you go to bed, you'd wear that to bed. You'll curse me for maybe the first 2 or 3 minutes, but as soon as you fall asleep, you won't even notice it. You'll wake up in the morning. Those things will be bone dry. You'll find you've had a great night's sleep, and you'll find some relief in your feet. Still on the topic of socks are compression socks. So compression socks have been used in countries like Australia for decades. They have stacks and stacks of data on compression socks and healing. And healing, or not compression socks, compression garments. So they use they've used it as a part of their healthcare system down there for a long time. And what it does is it increases circulation to an area. And when you increase circulation to an area, you're increasing lymphatic flow, so taking away the garbage and bringing in the nutrients. So that's where healing happens. So get yourself a pair of compression socks and wear them to bed, wear them around the house, wear them where and however you'd like. Hydrotherapy, or the use of water, or specifically the contrast between hot and cold water, offers a lot of relief for neuropathy as well. And there's a couple ways you can do that. You can do the warming socks is actually considered a hydrotherapy, and also just plain old alternating hot and cold foot baths. So you want hot water. Don't burn yourself, but have it nice and hot. And so you want 2 containers that you can slip your feet into, one with hot water, one with cold water. You can even throw some ice cubes in that one. You're going to put your feet in the hot water for 3 minutes. You're going to switch over to the cold for 1 minute, and then you're going to repeat that 3 times. So the whole treatment takes you 15 minutes. What are you doing? You're expanding, you're contracting, you're expanding, you're contracting. You're causing that pumping action. What are you pumping? You're pumping lymphatics, you're pumping blood, you're tonifying the tissues themselves. So there's a lot of naturopathic medicine is one of the foundations of naturopathic medicine is hydrotherapy. I use it whenever I can, all over the body. And then, of course, there's the good old foot soak and Epsom salts, magnesium minerals, which I like because they're a little bit more potent than Epsom salts are. Once again, lavender, a few drops of lavender in that oil, and you can just soak them in that salt for, 15 minutes or so. There is a great product out there. I have a colleague, I guess you would, who produces amazing CBD products, and she has a mineral, a magnesium mineral that's infused with CBD and lavender. Oh, it's like heaven. But, using those magnesium actually calms those nerves. And, you could even take magnesium orally if you're having real problems with those, with that neuropathy. So overall, there's a lot you can do. I see it every day. And, it would be great to get to the point where that neuropathy becomes a reminder that you've done something silly. I was talking to a young lady yesterday who'd been to 3 weddings in September and then went through Thanksgiving not paying attention to her diet. And she said, "Oh yeah, my body reminded me." And the beautiful thing is that you can control it. So anything that has to do with reducing inflammation, soothing the nerves, can give you that relief from neuropathy naturally. So I'm just going to go over here and see what else is going on in the chat. Acupuncture is great. What method do I use? THC. Canaway is a brand. Good info. Thank you, Rachel. And lavender Epsom salts bath. Yeah, sure. You can do a whole bath soak. You don't just have to soak your feet, right? And compression socks are helping Nancy a lot. So there you go, folks. Thank you for your great comments in the chat. And thank you for being here this evening. It's always great to talk to you and to provide you with more information about transforming MS naturally. I will see you next week, same time, same place. In the meantime, take gentle care. Bye-bye.